Is obesity a genetic disease, Rudy?
So that is a very fascinating question. Is obesity a genetic disease? And like everything in medicine, it's complicated. To me, it's a yes and no, because we have to think about monogenic and polygenic. So, yes, first I'm going to say yes, it is it can be a genetic disease because they have monogenic diseases like Prader-Willi syndrome. You have other things like a leptin resistance, where it's one gene that is abnormal, and 100 of those patients who have this will have the phenotype of obesity. That's a monogenic disease. This is a rare form of obesity. I've seen a couple of cases of this when I was training at the University Hospital in Miami. Most obesity that we deal with is polygenic, meaning it's not one gene, it's hundreds of genes that interact with lifestyle and social economic factors to create obesity. So if you see that in your family, people tend to have overweight or obesity, you are at a higher risk of developing this. But your genes pool but we always have to remember that your genetics load the gun, the lifestyle pull the trigger. So the obesity that we're seeing in most of our patients is not the one gene monogenic disease that we're seeing. It's a complex interplay of lifestyle, socioeconomic, and genes that can get there. So with that type of obesity, you can prevent it. Just because your parents or your family have it, you may not follow in those footsteps. You control it. But here again becomes the difficult question, right? Because always we tell our patient, come on, you can do better. You can eat better. You can exercise a little more. You can say no to those donuts. And those poor patients go home, they do it for one day, 1 week, then they go back into the addiction of food. Then they have self resentment, self hate. When they feel like this, they want to eat more. They resent themselves, they eat more. So here goes the yo yo of obesity and metabolic disease. So, on those patients, again, if I can find something that interrupts that pathway of food addiction, we can reverse obesity. So, is obesity a disease? Yes, it is a disease. We have an ICD 10 code now in the US that designates it as a disease. Is it a willpower issue? Yes, there is a willpower issue, but what we need to realize is sometimes you cannot overcome your willpower with psychology only. You need an improvement of your physiology and your biology. If I improve your your neural circuitry, if I improve your neural pathways, if I restore your appetite physiology, now I make it easier for you to make the right decision. So this is to me the complicated form of of dealing with metabolic disease and obesity, because it's not a simple question of just use more willpower. There is a biological underpinning, a biological maladaptive phenomenon that's happening in our brain circuitry that perpetuates the cycle of obesity. And until we recognize this, we'll keep our patients with obesity in the victimhood mentality. When I give my patients those tools, I empower them to make the right decision. And I think that's how medicine should be.